Welcome to the vital process of rehabilitation following a total knee replacement. The early weeks of recovery are pivotal, and the exercises we'll delve into today are designed for the initial 4 weeks post-surgery. Disclaimer: before starting any exercise regimen, it's imperative to consult your healthcare provider to ensure you're on the right track. It's equally important to approach these exercises with caution and mindfulness. Start slowly, paying rigorous attention to your form. Begin with 1 set of 10 repetitions, and as the weeks progress, aim to gradually enhance your stamina to 4 sets of 10 repetitions. For these exercises, it is normal to feel some discomfort, especially near the end of range of motion. However, stop if you feel any sharp pain. Okay, let's get started. Beginning with the step to gait. With walker pattern, it involves using a walker, advancing the walker forward, then stepping forward with the affected leg, and following by stepping 2 with the unaffected leg. This approach ensures stability and a controlled movement pattern. Transitioning the step through gait pattern. With cane requires you to hold the cane in the hand opposite to the operated leg. Progress the cane and the unaffected leg forward, then engage in a normal gait pattern, stepping through with the affected leg. It's essential for a smoother walking transition. Lying down for the supine ankle pump, move your ankles up and down. This exercise aids in circulation and can stave off swelling. Next, the short R quad is where you place a rolled towel under your knee and then attempt to straighten it. It's designed to build strength in the quadriceps muscles. For the supine heel slides, bend and straighten your knee by sliding your heel towards your buttocks and back. To ease the movement and reduce friction on the knee, consider using a plastic surface or bag beneath the heel. The supine straight leg raise involves you lying down, lifting the operated leg straight without bending the knee, targeting the hip and thigh muscles. Shifting to a seated posture. The seated knee extension bedside entails extending and bending the knee while at the bed's edge. This movement allows the operated knee to gently hang, providing distraction to the knee joint and aiding flexibility. Subsequently, in the seated knee extension with well leg assist, the non-operated leg assists in the extension, promoting a synchronized movement. The knee extension in chair requires standing behind a chair for support, focusing on extending the knee and holding this position for 2 to 5 seconds, reinforcing balance and strength. Standing heel raises involve pressing through the balls of the feet, elevating the heels, emphasizing calf muscle engagement. With mini squats, you'll bend your knees slightly. For additional support, consider using a walker or chair, ensuring stability, while focusing on strength and mobility. Concluding with the standing knee flexion, bend your operated knee while standing, aiming to draw the heel close to the buttocks. Remember, every step in recovery counts. As Robert H. Schuller wisely stated, tough times never last, but tough people do. Stay committed, and you'll soon appreciate the fruits of your dedication and effort.